What are your risks of bleeding during pregnancy? Could you develop pregnancy-related bleeding spontaneously or after activities like sex or exercise? And is there anything you can do to prevent this? Hello, health conscious people. I'm Dr. Sylvia, a fellow of the Royal College of General Practitioners and a health educator with Askawayhealth. Welcome back to the channel and another lesson on vaginal bleeding. This time the focus is on some of the causes that can happen during pregnancy. If you're interested in helpful health information videos like this, go on and give it a like and subscribe to the channel. Don't forget to click the notification bell so you know every time we publish new health information videos like this. Now, let's talk about the risks of bleeding during pregnancy. Many patients come to me after experiencing bleeding during pregnancy, worried about what caused it and whether there was something they could have done to prevent it. I say that pregnancy-related vaginal bleeding is quite common and often does not affect the outcome of the pregnancy. However, in some cases, it can do so, so it's always important to speak to your doctor or your midwife if you experience any form of vaginal bleeding when you're pregnant. To start, let's look at some of the causes of bleeding that happen in the early half of pregnancy, the first and some of the second trimester up to the 24th week. Number one, implantation bleeding is a form of bleeding that happens at the very early stages of pregnancy. It is harmless, and in most women who experience it, it is light bleeding or spotting. Spotting means that you would only experience a few spots or drops of blood loss. In addition, there is usually no pain. It may resemble a very light period in some ladies, and in fact, some ladies assume that it is their period until it becomes more obvious that they are pregnant later on. Implantation bleeding happens when the developing pregnancy plants within the wall of your womb. Are there any risks for this happening? No, it's harmless and is part of the normal pregnancy process which some women may experience. Number two, miscarriage. A miscarriage is what happens when a pregnancy ends before 24 weeks. It is most common within the first 12 weeks of pregnancy, and generally it is thought to happen if something is not right with the baby. Vaginal bleeding may be the first suggestion that there is a miscarriage going on, and the blood loss may be light pink or fresh bright red blood or even dark altered blood. Other miscarriage symptoms are having painful cramps low down in the stomach that sometimes are stronger than period cramps. Some women in addition may experience tissue loss, including blood clots and parts of the pregnancy coming through the vagina. Experiencing bleeding from a miscarriage does not always mean the loss of a pregnancy. Some studies suggest that half of women who bleed like this go on to have a normal pregnancy. Most times, we cannot prevent a miscarriage from happening, but here are some risk factors that might make it more likely to happen. Being around the age of 35 years or older, being overweight, smoking, alcohol use of street drugs or illicit drugs like amphetamines, heroin, cannabis or cocaine. And coffee lovers, watch out, taking more than 200 milligrams per day can increase the risk of a miscarriage. A small homemade cup may contain about 50 milligrams of coffee, but some other coffee drinks could have over 300 milligrams. It is generally recommended that pregnant women limit their intake of coffee to 100 to 200 milligrams per day, which is around 1 to 2 cups of coffee. However, many experts recommend avoiding coffee entirely during pregnancy, and if you want to be absolutely safe, this is the smart choice. What about other problems that could increase the risk of a miscarriage? Well, there's food poisoning from contaminated foods or drinks, so be careful with things like salads, ice creams, fruits, and watch the sources of your drinking water. An injury from accidents like a car accident or other forms of trauma can increase the risk of a miscarriage. Certain medicines can also do the same. Examples are some antidepressants, some over-the-counter anti-inflammatory painkillers like ibuprofen or naproxen, and some rheumatoid arthritis treatments like methotrexate. Next, infections like a urinary tract infection or sexually transmitted illness can increase the risk of having a miscarriage. And don't forget chronic conditions like diabetes mellitus that is either not treated or poorly controlled, or having high blood pressure in pregnancy. So make sure you check out my video here on high blood pressure during pregnancy to learn more about this condition. Moving on to the third cause we're talking about today, which is ectopic pregnancy. An ectopic pregnancy happens when the fertilized egg plants itself anywhere else outside the womb. Most often, this occurs inside the fallopian tube and usually develops from around 6 weeks onwards of the pregnancy. It's a serious condition that can cause death without treatment. The fertilized egg just cannot develop anywhere else but in the womb. So when it's planted outside of it, it fails to develop properly, or in the fallopian tube, it could burst it and cause serious complications. It is not possible to save this pregnancy, and so the egg has to be removed, and sometimes the fallopian tube as well. Vaginal bleeding is one of the symptoms of an ectopic pregnancy. It could be very heavy bleeding with blood clots, or light bleeding that's just not stopping, or even a watery, light or brown discharge. Other symptoms include a tummy pain that sits on one side more than the other, and some women complain about experiencing discomfort in their shoulder, while others complain of pain when doing a pee or a poo. But let's look at what puts you at risk of having an ectopic. Having a previous ectopic pregnancy increases the risk of another by about 10%. Surgery on your fallopian tube in the past, for example, a failed female sterilization. Having inflammation within the reproductive organs known as pelvic inflammatory disease, which is a condition usually caused by sexually transmitted infection. Another reason is falling pregnant while on the contraceptive coil, either the IUD, the intrauterine device, or the IUS, intrauterine system. In the first place, the chance of falling pregnant while on these contraceptive coils is very small. But if it does happen, an ectopic pregnancy is more likely to develop. Other factors are smoking, as well as being older when pregnant, often between the age of 35 to 40 years. And lastly, fertility treatments like IVF can increase the risk of an ectopic pregnancy. So next, we will look at bleeding conditions that happen in the latter half of pregnancy. But before we do that, what about bleeding in pregnancy that's associated with sex or exercise? And also remember that bleeding during pregnancy can happen from an infection in the pelvic tract or a urinary tract infection. Treating these promptly will in most cases resolve the problem and not affect the pregnancy. Bleeding after sex happens in some pregnant women, and this is usually because the cervix, that is the neck of the womb, happens to be tender and sensitive at this time. Whether the bleeding happens to be light or heavy, you must always see your doctor if you experience bleeding after sex when pregnant to look for signs of infection or even rarely signs of a cervical cancer. Thankfully, the cause is often a sensitive cervix, and taking steps to avoid irritation of the cervix can help. Once you've been given the okay from your doctor, you and your partner can explore alternative sexual positions. One good example is lying on your side during sex to avoid any pressure on the cervix. Now, what about exercise? There are so many health benefits to exercise, especially when you're pregnant, that it is a recommendation that you do have some form of exercise as long as you're fit and do not have any underlying medical conditions that could cause a problem. Activities like walking, yoga, swimming are all recommended, and exercise is extremely unlikely to cause bleeding when you're pregnant unless it's extremely vigorous or there are other underlying medical conditions, some of which we've talked about already. In the later part of pregnancy, some of the reasons for bleeding can still happen. For instance, bleeding due to pelvic or sexual infections or urinary tract infections, or even bleeding after sex. In addition, there could be non-cancer changes to the cervix, like the development of a cervical polyp that can lead to bleeding. But what about the other problems that can happen during the second or third trimester? The first is called placental abruption. As the name suggests, this condition affects the placenta, which is that soft body of tissue and blood vessels, which is crucial for the growth and nourishment of the baby. Placental abruption usually happens during the last 12 weeks of the pregnancy and means that the placenta has come away or detached from the lining of the womb either before or during labor. Thankfully, it is not very common, but the symptoms do include vaginal bleeding as well as stomach pain. In some cases, there may be stomach pain without experiencing vaginal bleeding. So could you develop placental abruption? Well, here are some of the risk factors that we know. If you're aged 35 years or older, if you've had other children, so this is not your first pregnancy, having had this condition before can increase the risk of having placental abruption again, suffering from high blood pressure in pregnancy, or having a condition known as sickle cell anemia, if you've been using street drugs like cocaine before or during the pregnancy, or having experienced any trauma or injury to your stomach and abdomen. Another placenta condition that leads to bleeding during pregnancy is known as placenta previa. This condition is a lot more common than placental abruption that we've just discussed. Placenta previa happens when the placenta lies low down in the womb and is partly or completely covering the cervix. A low-lying placenta is extremely serious and needs immediate attention. It can cause vaginal bleeding that can happen without pain. Again, let's look at the risks for a woman to develop placenta previa. It could happen if you've had children before. Other risk factors include having had surgery to the womb in the past, if this current pregnancy is a multiple pregnancy carrying twins or triplets, and if you've previously had a cesarean section. Preterm labor can happen when you go into labor before your due date. Vaginal bleeding or discharge is a symptom of preterm labor. Other symptoms can include cramps, stomach cramps, experiencing dull low back ache and a feeling of pressure within the abdomen. It can happen spontaneously, but sometimes can be as a result of stress or trauma to the abdomen, or infections, or conditions like high blood pressure or diabetes not being properly controlled in pregnancy. If you think you have any of these symptoms that suggest preterm labor, please seek immediate medical attention. You can see from the list of these conditions that I've shared that there may be some you can't really do much about, but depending on your habits, there might be a few that you can amend. Stopping smoking, alcohol, drugs and certain medicines when you're pregnant, making sure that you attend antenatal classes so that your blood pressure and blood sugar is continuously monitored, and making sure you practice safe sex before and during your pregnancy can help to avoid some of these conditions that can cause bleeding during pregnancy. Now, has this video helped you rethink some of your habits and ways that you can reduce your risk of bleeding during pregnancy? Do let me know in the comments, and don't forget to give it a thumbs up if you found it helpful, and subscribe to the channel if you've not done so already. Next time we'll be looking at ovarian cysts, in particular polycystic ovarian syndrome, PCOS. How does this condition affect your periods and fertility? Make sure you've clicked the notification bell so you know when that video goes live. Check out these two while you're waiting, and I'll see you again soon. Stay healthy.